eye bags come back after surgery? Usually not, but if the surgery is a little bit more conservative, sometimes you will see some residual fat that you might want to go back and take a little bit more fat out. Especially around the eyes, you don't want to be too aggressive the first time, because once the fat's out, it's very difficult to fix that. So it's much better to be more conservative, and then if you need to take a little bit more fat out later, that's always something that you can do. Do the bags come back years later? Maybe, to a certain degree. In some people, you will see some of that fat come back as those areas become a little more lax with time, as everything does. But usually this is not necessarily something that we see, and if you see it, it's 15, 20 years later, if that. Is eye bag surgery painful? It's really not. This is one of the least painful surgeries you can have. Sometimes people will have a little bit of a headache kind of behind their eyes for that first day that they've had surgery, but generally that goes away that day, and you don't need any pain medications. What's the best procedure for under eye bags? If you have under eye bags, usually the best thing is to have a lower blepharoplasty. That is where we take the fat out that's causing that those bags and that pooching under the eyes. Depending on what your anatomy looks like, you may just take that fat out, or if you have deep tear troughs underneath your eyes here, we can take that fat and reposition it to where it lays in those areas to where it's like a permanent filler. Sometimes people will do fat transfer, where they take fat from other places and fill in there, and that's another option as well. If you have excess skin, making an incision underneath the lashes is a great way to tighten that skin as well. Or if you go inside the eye, most people will benefit from a laser over the skin, or something, peel something to tighten the skin, as well as taking the fat out. But in general, with all the things that are out there for eye bags, usually surgery is your best option. Have questions? I'm happy to help you anytime. Please give us a call or email.